Hi, everybody. Welcome back to another remote episode of Rapping with the Rep. I'm State Representative Ken Gordon, and I'm here with our State Senator Cindy Friedman. Welcome back. She's been a frequent guest on our show. Welcome, Cindy.
Hi, Ken. It's great to see you. And I hope you and everybody who's listening and watching is doing well.
Thank you. The same. What we're going to do is we're going to talk about some of the legislation that was passed at the end of the last session. We're beginning our new session now in January, and we really had some accomplishments that we want to talk to the folks in Burlington and the other towns like Bedford that are also getting this as well. One of the most important bills that just came out that is now a law is the new healthcare reform law that Senator you worked so hard on as chair of the committee and then on the conference committee. So can you explain all the ways that bill is going to help the residents of our area?
Sure, I'd be happy to. So this was a bill that was filed by different versions in the Senate and the House, and over the fall, the conference committee, which was myself and the now Speaker Mariano, along with two other senators and two other reps from each side, conference got together and came up with compromises or pieces that we felt we could agree on, and it was really a great effort by both the Senate and the House conferees, and I think we came to a very, very strong bill. The first part of the bill that I think everybody was focused on and really kind of anxious about was telehealth. And was telehealth going to continue and be available to the residents? And in fact, it is. And it is, we've expanded telehealth now into law. So it's a requirement that telehealth be covered as an inpatient is in the same as in person, and that if it's appropriate, then it would be covered. So of course, some things aren't appropriate to be covered under telehealth, and those there's no mandate for that. But for everything else, there is. And some really important pieces is that behavioral health will be covered at the same rate parity as in person permanently. So this ensures that providers are paid at the same rate as if they're delivering in person. We also extend rate parity for chronic disease and management and primary care for 2 years. Those rates will stay the same as an in-person visit. And then the other services that are being delivered will be covered at the same rate as in person for 90 days beyond the emergency order that the governor put in last March, I believe. So this ensures that telehealth is here to stay and that it's accessible and available. It also covers telehealth across many different platforms. So audio, visual, it allows for audio alone, so you can just do it over phone. So we've really tried hard to make sure that it's accessible to everybody, whether or not you have internet, whether or not you have video. So this is a very big step for Massachusetts. And I think you all are well aware of how much telehealth activity went on during the pandemic and continues to go on. And we wanted to make sure that this very successful delivery service was stayed in place. Another thing we do, which I think is really important, is we extend licensing for certain healthcare providers. So people that are well-trained, have experience, and are very critical to the delivery of healthcare, we've now allowed them to work to the extent of their training and licenses. And this is nurse practitioners, nurse anesthetists, psychiatric nurse mental health specialists can all practice independently, provided that they meet certain education and training standards and that they've had supervision for a certain number of years. We also allow Massachusetts optometrists to treat glaucoma. And we recognize that pharmacists are healthcare providers and that they can practice independently if they're fully integrated with a coordinated care team. These are all proven steps to expand access to healthcare and to make sure that people who are trained can work to the top of their license and to their full capacity. We've also shored up some of the payments to community hospitals to help them mitigate the unprecedented financial challenges that they face and continue to face during the COVID-19 pandemic. These are hospitals that serve a high proportion of public payers who aren't part of a very wealthy system and that are critical to providing service to people in communities, especially people in low-income communities. And then there's some other things that we do. We start to address the out-of-pocket or the surprise billing issues. We require that providers now are very clear with patients whether they're being sent to somebody out of their network so they won't receive a bill that they didn't know about because their provider wasn't covered by their insurer. And we've also set up a committee that we've given till September to come up with a proposal for how to address surprise billing, especially when people go into a hospital for an emergency. And so we'll have something in September, and then we're committed to act on those recommendations and end surprise billing once and for all. Those are the big pieces of the bill. We require insurance carriers to cover treatment for PANS Panda, a childhood disease. We also set up a rare disease advisory council and to look at how we are handling and what the best up-to-date health information is about rare diseases. They often get overlooked and we don't pay attention to them. And this will help us to focus more on those rare diseases while they're rare, affect a lot of people. We make it easier for people to get paid for cancer trials so that they can pay for transportation and lodging. So there's things like that in the bill. I also would like to point out that along with this, we, in the FY21 budget, there were several priorities that we had in that budget that we got funding for. And I think this is really important. We have $10 million for the creation of new inpatient mental health acute care beds to try and relieve some of the pressure on behavioral health and access to behavioral health for people who are suffering from an acute condition. We add $950,000 for the mental health advocacy project for kids. This takes care of kids who are in foster care or in low income. It allows them to get access to care, especially when they have run-ins with law enforcement or their schools. And then we added more money, $350,000 to support the development of school-based bridge program, which is a phenomenal program that helps schools and kids deal with suicide. And then I would be remiss if I didn't say that Rep. Gordon and I successfully secured $250,000 to continue the work to establish a Middlesex County Restoration Center. We are part of the Restoration Center Commission, and we're tasked with creating a diversion program that will assist individuals experiencing mental health or substance use crisis by providing access to community-based treatment and diverting them from the criminal justice system. Those are a few, just the very highlights of what we've done on the healthcare side. There's lots more to do. I think we're going to be addressing, I hope to be addressing the high cost of pharmaceuticals, out of network, better access to primary care. These are some of the things that we're going to be taking up this session.
Thank you very much, Senator. I want to unpack a little bit of what you said, because these are issues that are going to affect our everyday lives out here in the community. And so during this COVID crisis, more people have turned to and have become comfortable with telemedicine, calling a physician so that the immediate response isn't, well, come on in, because sometimes we haven't wanted to go to a health care facility because the virus has been present in our communities. And so having been introduced to that, what this bill does is it makes permanent some of the very convenient and cost-effective ways of getting treated, so that when we're feeling ill, it may be more often, more common that the doctor just calls us, right? Or sets up a video appointment, such as you and I are talking right now, and we can handle our healthcare in that way, which will really help people to treat conditions and to get better quicker.
Yeah, I think it's a really proven method, especially for taking care of chronic disease management. So it makes it easier for your doctor or nurse practitioner or physician assistant to call you up and say, hey, are you taking your medication? Here, take your blood pressure, I can see it. And doing care that doesn't necessarily mean you have to come in, but that somebody can see you and talk to you. It makes it much easier. It's also, for people, I don't think up until now, so many people have appreciated what it really means to have to go to the doctor, right? I mean, you have to plan a day, you have to set up an appointment. For many people who work, they have to take time off. They drive places where they have to pay for parking. All of these are barriers to people getting healthcare that can just as well be delivered through telehealth. And so I think we're going to see a big impact. I think that one of the most fascinating statistics is that in the behavioral health space, the average the no-show rate was around 60-65% a lot of times, right? It went down to 5%. That means that people were able, when you think about people who have an illness or a condition, just being able to get someplace is a huge barrier. And so this is really, now there are downsides and there are things we have to figure out. But I think we're now committed to making telehealth a successful part of our treatment.
You mentioned behavioral health, and I think that's one of the most important aspects of this program, because like you said, many of the barriers are physical and some are emotional to getting proper behavioral health. Some, still believe that, there's a stigma or something like that, and that we've broken down those barriers. But to be able to, in one's home, get that treatment, get it efficiently, not have to drive to it, it comes to you essentially. Excuse me.
Right.
It's covered in the same way.
Right.
Is so important, and we've been working for years to get parity for treatment on these issues, and to do it through telehealth is a way to do it effectively. So, congratulations on doing that. That's great leadership by your part, and I'm so happy to be able to support it. One aspect of the bill makes it easier for people on Mass Health to be able to get treatment, and this was something that someone from our district, AFC Urgent Care, helped with, showed me and showed us that people on Mass Health sometimes don't have a primary care physician, so they come in and they can't show the proper paperwork to get treatment at an urgent care center, and they're sent to an emergency room, which is inefficient and more expensive. So what this does is it breaks down that barrier, so that these people, they don't have to provide evidence of a primary care physician. All that happens is that the urgent care center gives them a list of physicians, recommends they go see them, but can treat them.
Right. Well, actually, it goes a little further than that. It has to notify Mass Health that somebody has come in, the name of the person, so that Mass Health will follow up and help with getting a primary care. But it's keeping track of people who don't have a primary care physician. And this really is, it's the first and probably most important question that people need to get asked is, who's your primary care physician, right? Because your primary care physician should be your gateway into into healthcare. And that's why it's so important that people have a primary care and that we support primary care, which we don't really do very well right now. And that's what we're going to work on this session.
I want to talk about the vaccines for COVID that are coming out now, and I know that you're actively involved in the commission to address that. Can you talk a little bit about what we're doing on the vaccine front?
Sure. So I know this is a very, very fraught issue for a lot of people, and I understand how anxious and confused and frustrated this vaccine rollout appears to be, or appears to be. Some of it is well-founded, and some of it is bad reporting. But I am a member of the COVID-19 Vaccine Advisory Group, and I can provide some context about the vaccine distribution plan, and then maybe talk a little bit about the data. Just briefly, without getting into it, we were tasked with coming up with how to roll out a vaccine that will not be available for everyone because we do not have enough doses. The doses will increase over time, but right now we are very limited in what we get, and everything we get, we're getting from the federal government. So our approach was formed by a very basic concept. We can best reduce the number of deaths from COVID-19 and reduce the risk of overwhelming our healthcare system by identifying those who are most likely to die from the virus and those who are critically needed to take care of COVID-19 patients and other vulnerable populations. I think we all agree that if we lose our healthcare workers, if we lose our ability to provide care, then we will all suffer. And so we provided the guidance that we came up with within this framework. Okay, who is most likely to die, and who do we need to take care of people? So that's how the phases came up. And I know if you go on to the COVID-19 vaccine, if you just Google COVID-19 vaccine rollout Massachusetts, you will see the phases that we came up with. And the first phase, it's really people who are in the healthcare system and people who deal with the most vulnerable long-term healthcare facilities, rest homes, et cetera, and congregate care, because they are the most vulnerable and most likely to get the virus and most likely to die. And then we go into phase 2, which is people that are greater than 75, people who are, and also who have 2 serious complications that make them a higher risk for COVID-19 complications. Essential workers, people over 65, people with 1 existing condition. And then phase 3 will be rolled out to the general public. That's the very general. And I know there are lots of ways that we can parse this. And it's not saying that somebody is more important than somebody else. I've heard a lot from people who say these people should be elevated in the phases. These people are more important. These people are critical. There's no, for instance, getting around the fact that our teachers are incredibly critical, because we need our children to be in school, and we need, because the loss of that education and that time, it will have a profound effect. It doesn't quite have the same profound effect as if somebody who will most likely die if they get the vaccine, if they get the virus. And that's the kind of tough decisions that we're making as a state. And so it's not that people aren't important, it's that people are at higher risk and are more likely to have to die than some other people. Now, just having said that, if you're a teacher, for instance, and you have two underlying conditions, high blood pressure, let's say, and diabetes, you're going to be in that first tranche of phase 2, which we are going to be in February. So it's not like you are a teacher and so you won't get the vaccine until the teachers get them. You're also, people will fall into the category that makes them most vulnerable. Now, I will say that, and just to, if I could go on for a minute more, that, as of last week, because these are the latest numbers that we have, the latest official numbers that we have, as of last week, we received about 350 or 345,000 doses from the government. Some were Pfizer, many more were Moderna. We administered 240,000 of those doses, 239 and something, to those doses to people in phase 1. So we're running at about a 65% rate of getting that limited number of vaccines out. And just to put it into perspective, two weeks ago, maybe 3 now, I'm missing my time, we were at a third of getting those out. And then the following week, we were at a half, and now we're up to 68%. Now, those numbers go up and down because we get vaccines one day, and if you take those numbers from a shipment we get and you do the math of who got it, those numbers will go down. But then, wait a couple of days, they're delivered, and those numbers will go up of how many people. So we are getting better at getting those vaccines out. Lots of our local boards of health are very good at saying, hey, it's 2 o'clock, we've got some 6 extra doses. Let's go down the list. Who's next on the list? Let's give them the vaccine. So people are working extremely hard to keep it rolling. And I think you're seeing more and more procedures and people in place to give that vaccine. It's going to take some time. I think the state could do much, much better at communicating how this is all going to happen. I think it's very frustrating for people that they don't even know when to know. And Ken and I will continue to work on that and get that information to you.
Senator,
I hope that's helpful, Ken.
Yeah, it is. What level of confidence do you have that we're going to be able to continue to get the doses from the federal government that we need? In other words, that the flow of doses will come in.
I have not talked to one person in this field or that does this kind of delivery system and supply chain that doesn't say, look, there are glitches in the supply chain, in any supply chain. This is all brand new. These companies are working, 24/7 to make these vaccines, but we would fool ourselves to think that it's all going to go perfectly smoothly, that there's always going to be the material that's needed. There are going to be glitches. And that's why, number one, it's incredibly important that we make sure we take care of the most vulnerable and our healthcare system, and that we continue to be safe, to wear our masks, to stay at home, to social distance, to wash our hands. The things that we've being told, they all still hold, and we have to do them. And I am as tired as you all are of this. I woke up this morning and I looked at my husband and I said, are you kidding? We're still doing this. And it's the end of January. So I get the frustration. I get how tired we all are. I just want to hug my kids. I want to be, sitting in the living room on top of each other, yelling and screaming. But we have to stay vigilant.
Right. And we are in the home stretch. And this isn't
we are in the home stretch. Yeah.
Right. It's a healthcare issue. It's not a political issue. It's not a statement.
Right.
We're doing what we can to protect each other,
right.
to show respect and concern for each other. And we can get there. We've gone this far. Yeah. We can get there.
Yeah. And we absolutely acknowledge it is not perfect. It is not perfect. We are building the highway as we're, speeding down it at 90 miles an hour. So.
Right. Well, thank you for your work on that. I want to talk a little bit about the economic development bill that was also signed into law and some of the things in there. One of the most
Sure. Why don't you take that one? Yeah.
Okay. Well, one of the most important things that we have in there there's a proposal that came through from the governor, but we've been working on it as well from the legislature, is our housing choice bill. And just to back up on the reason that that's important to our district, our area, is that for our economic development to continue, the two challenges that we have are when we're back to full operation, we'll probably see the traffic come back in. And so businesses are saying, well, we're challenged by the traffic, and we're challenged because we don't have any place to bring employees. If we want to hire people, there's no place that they can afford to live. And that's really a bottleneck that we have to address. We have to address it for other reasons too. We have seniors in our district that are saying that when I reach a point where I no longer need that big house, where I raised my family, but and there's another family with a larger family that wants to move in. The problem is I have no place to go if I want to stay in this area. So I would love to sell this home. It's also a little hard for me to maintain it at this point in my life, but we have no choice for them. And so what this bill does is it makes it easier for our communities, if they choose to do so, to bring in other forms of housing into their area, because the law was amended. Previously, it said that in order to change zoning to allow for multifamily housing or other forms of housing, you needed to have a 2/3 vote of the state, of the municipal's governing body, which in our towns would be town meeting. You needed a 2/3 vote at town meeting. We've changed it to a majority, so it's 50% plus one. It was 2/3 is it's an interesting number. The problem is that 1/3 is controlling the agenda of the town. And when you have open town meeting in some towns, that means you can bring a number of your friends that live in town, and they can reach that 1/3 position, and progress doesn't occur. At elected town meeting, same thing. Although you're confined to the number of elected voters at town meeting, still it's the minority that controls. So this is a way that now we can have the majority control, and the towns can address this very urgent housing crisis. Our kids don't have places to live if they want to stay in our towns after college, and this will help to provide some housing so that they can do that. And so in that bill, that's included, which has been an important provision for it. Another thing that's in there that we're seeing now during this crisis is the cap on, which will be important, will be the cap on fees for the meal delivery services like DoorDash and Uber Eats and these places. They were taking 30% of the profits, 30% of the revenues away from these restaurants, and it left them with hardly any profit at all. They were engaging in these delivery services because it kept them in business. But we provided a 15% cap. We continued on with the emergency provisions for no fault to help with evictions. We establish a local option so that a tenant has a right of first refusal to buy a home in certain situations. So if the landlord is selling the home, you live in it, it'll give you an opportunity, if you meet certain conditions, to jump in and say, well, I'll buy the home. And that way I don't lose it. We also have a student loan bill of rights, because we know that student debt has been a crushing a condition that's faced so many people in this state, and we'll be able to look at and help people who are really been victimized by taking on so much debt. And one thing that's really important to me, having started my career in local journalism, well, in journalism altogether, is we're going to study the conditions that challenge local journalism in this state. The media is so important. We've seen that on a national level. We see it at a local level. You folks watching this have a right to know what we're doing and to follow the current events in our state, in our country, and locally. And this will help to provide access to that information to you. And then through Senator Friedman's office and mine, we were able to assist our towns in developing our commercial space in the way that we need to do that, which is in our case redeveloping. We're just taking existing space. We've got a lot of open office space because during this pandemic, but leading up to the pandemic as well, these office buildings weren't being fully used anymore because of the way that we conduct our business now. But what we need are places where we can bring life sciences businesses to our area, because that is our lifeblood right here in Burlington and the surrounding areas. These are our income and revenue generators. The problem is that we've got to convert these office buildings into lab space. The way that we're helping to do that is we're providing funding to the landlords so that they can convert, before they get a tenant, they can convert to become appropriate lab space for life sciences to help them to flourish in our area. And we've got $250,000 for Northeastern's Burlington campus to support research in that very area. This was a place that we in the legislature created that out of a $3.5 million fund that had committed dollars to going into that area. The final bill signed by the governor is a little bit more vague as to where they'll find the money within it, but it's still there. In Bedford, by the way, those of you watching from Bedford, we have $165,000 for the installation of EV stations for electronic vehicles, which is also an important energy means to going into our future. So these are all important advances. The money, by the way, that I just mentioned is legislative authorization within this bill. The governor now chooses how to spend it, where to spend it, or to spend it at all. So our work is still in front of us as far as working with the governor to get those appropriations. And for Northeastern's Burlington campus, we were able to get authority for $250,000 to address programs involving life sciences. This program, from the legislature's point of view, when we passed this bill and sent it to the governor, we had actually created a designated fund from which this funding would come. But in the final bill that the governor sent back, this is an appropriation equal to the rest. And what I mean by appropriation is that the legislature has now authorized all of this funding, but it's up to the governor to decide when to fund it, how much of it to fund, and frankly, whether to do that. So we still have work to do in approaching the governor to get these funds released. In addition to that, the governor signed much of a transportation bill that we sent him. He vetoed some portions of it, but what I want you to know with respect to local authorization, again, is that we were able to get basically $3.5 million for Burlington to address roadway and sidewalk construction. For Bedford, we were able to get $50,000 for the Minuteman Bikeway for improvements there. So those are some of the highlights of some of the bills that were passed, sent to the governor, and signed into law. Now, one bill that was passed by the legislature and sent to the governor that was vetoed was the climate bill. What we plan to do in the legislature is to take up this climate bill again early in our session and send it back to the governor, where we'll have more authority to deal with some of the issues there. The issue there is that we essentially agree with the governor to a goal of being completely energy efficient, relying on renewables by 2050. It's the sort of the benchmarks along the way that we set. The governor feels that it's too soon to impose some of these benchmarks. We think it's perfectly doable. We can certainly negotiate a resolution on that. This will give us more time to do that. There are important parts of this bill that should get through. One of the important parts is called climate justice, environmental justice, which is that we have certain parts of our state in which people live in much dirtier communities than other parts. And we should do, the government should do its part in order to not victimize, to really to target these particular communities. And we can do more so that their health can be protected as much as the health of other people. Many of the people who live in these communities are people who are, minority groups and people that are economically disadvantaged, and we can do more. So those are the highlights of the bills that were passed and one that wasn't at the end of the last session. Again, it's been my pleasure to be here with State Senator Cindy Friedman to talk about the ways that we're able to address our life in the community, make life a little better for our constituents. And thank you for tuning in. I am State Representative Ken Gordon, and we'll see you next time on Rapping with the Rep.